Just a sense of my journey. Most of us don't really get a look at our information, but that's a picture of my liver back when I had gallbladder surgery, and that's a pretty darn ugly thing. And if you ever want to think about having a shock, have your doctor show you a picture like that right out of surgery. But that was in 2010, and I went through a lot of diagnosis stuff, and I didn't get access to testing that I wish I had. And as I look back, there are so many opportunities for me to have learned things that would have helped me. That when you look at that biopsy there in 2015, at that point I was really cirrhotic. I mean, that's my personal slide. And I wasn't in liver hell. I didn't go through what Tony did, but I could see it from where I was. And so I'm one of the patients who have so far managed my disease well. And I've done that in part because I had the opportunity to measure some things along the way. So on the right, that is actually the course that my liver stiffness has taken from the time of my diagnosis up until today. And I've been able to confirm it with FibroScan and MRE along the way. So we'll talk about those a little bit, but what that is a change from a dangerous NASH cirrhosis to of a level 4 disease to a borderline 3, 2, 3, that if I am careful, it should not be the thing that leads to my death. So I feel really good about that. And so I want to share some of those things with you. Next, please. Next slide. So anybody that's ever written anything, that as an editor, your mind goes crazy and you don't see your own mistakes. That shouldn't say disclosures. That should say Fib4. So one of the interesting calculators that has been around for a long time and has come into favor in a portion of the medical community is very simple, and anybody can do this. I mean, you all have the data that you can do this calculation yourselves. And there's calculators online for it, but it takes your age, your AST, ALT, and platelet count, and it derives a probability that you have advanced fibrosis. Next slide. And what they did in Sweden was that they studied about 40,000 people over 16 years. And they measured their Fib4s. And what they have been able to show is that the risk of severe liver disease can be, that a probability can be derived from that calculation that I just showed you. Next slide. And just as an example, this is mine. This shows you the course that I went through from the time that first ugly picture was taken. And at that time, there was not cirrhosis. And I was in the middle of this band between the low cutoff and high cutoff. And what those signify is if you're below that value, the probability that you have serious cirrhosis or serious fibrosis is low. And if you're above that, you have a high probability. And you can see that I fit I fit the mold exactly. The year that I crossed the high threshold, I got diagnosed with cirrhosis, and that's pretty interesting in itself. But let's go to the next slide. I look back, and in 1990, my FIB4 was 1.23. And if you just imagine that graph going way back to 1990, and I was below that cutoff, and I did not at that time have liver disease. And somewhere in between 1990 and 2010, when I learned that I had a sick liver, I crossed that lower threshold. And had I been monitoring my FIB4 over time, I would have been alerted to the fact that, well, maybe I should pay attention to this. And so, we recommend that people, just as part of what they track over the decades of their life, is this FIB4, because it's the trend that is instructive for you. And it's not diagnostic, but it gives you a direction, and it gives you some red flags, and you can start to ask your doctor, so what does this mean now? Help me understand what this is. So that's really important. So as I think back about the conference that we just had, one of the things that is a takeoff of this is a blood-based test, is that there's a whole lot of people right now that are doing research for blood-based analysis. And what they do is they take aspects of liver chemistry, and they try to come up with formulas like FIB4 that they can apply to people and determine or make a decision, or to give people an answer as to where they stand. So next slide, please. And just as one example, this is one that's done by Stanford that they're just releasing, and it's a medical calculator, and they call it the SAFE. And what it uses is the age, BMI, whether you have diabetes or not, what your AST, ALT levels are, what GGT is, and what your platelets are. And it calculates what they call a SAFE score. And you can see, these are my numbers. You can see that, I have a high risk, and I know that to be true. All of those things are real, but that is a calculator that they're developing as to serve a function similar to FIB4, but maybe be more accurate. And Mayo is doing one, and there's a whole host of people who are trying to develop this kind of test. So you're going to see those come into the market over the next few years. And, I really can enjoy talking about those, but they're not accessible to most people. So we'll leave that for another time. Next slide, please. Something that is worth, in a similar way, something that people have easy access to generally, because we all gets a few ultrasounds, and spleen size is pretty sensitive to liver stiffness, because as the liver gets stiffer, the spleen starts getting blood shunted to it. So, again, these are my numbers, and you can see that back in 1998, my spleen size was a normal 11-ish, and when I got sick, it shot up, and at my maximum spleen size, it was a 17, and that's not good. And as I improved my health, my spleen size went back down, and now I'm in a plateauing phase. But because I'm getting older, I'm probably developing, just because of age, I'm coming up a little bit. So those are the kind of things people can look at in their medical records and think about from their own perspective. So a lot of us have heard about FibroScan. So next slide. A lot of us have had FibroScan. This is my current FibroScan, but frequently doctors don't explain these things to patients. And what this one means, you see this cap all the time. And this is a non-invasive test, but the cap is a measure of fat in the liver. And I have a virtually fat-free liver. I've accomplished that. If I had a biopsy today, you couldn't find any fat in my liver. And that 9.6 is what I showed you on the slide, which is the stiffness. And when you see the pictures there, that channel that they're measuring is the speed of the shear wave as it goes through the liver, and that's how the FibroScan works. And if you ever have one of those, try to get them to give you a printout of it, because they do have it available. Next slide. So one of the new machines that is recently coming to market does a similar job. It's called VeloCure. It's by Sonic Insights, and it does a similar kind of process, but it does it, with a different kind of probe. But it gives similar information. It just doesn't produce the same kind of pretty pictures, but you'll see that come into the market because it's generally a less expensive tool, and it's part of the advancing technology we have in all of these testing devices. So next slide. So the blood-based markers, you have probably heard of FibroSure or FibroTest. Those have been around a while. And what they do is that the people that developed it did a regression analysis, and basically artificial intelligence, and they come up with these scales that are measuring fibrosis and inflammation activity. And that's been around a while. And the difficulty with them is these are all proprietary and expensive, and a lot of insurances don't cover them. But these kind of give you the future, if you will, the kinds of things that we're going to have available to us. And as we get insurance to pay for these kinds of tools, we're going to be able to have more information about the status of our liver and our general health overall. This is, liver is just part of the tremendous research that's being done these days. But next slide. One of the next steps, which is a similar thing, but it adds the next dimension to it, is a test called Liver Fast by Fibrognostics. And so where FibroSure gave you a measure of fibrosis and inflammation, the Liver Fast test has given you a measure of fat content. And again, these are my tests. These are my values. And I do this. I try these things because, I want to validate it against my personal experience because, I know a lot about my personal experience. And if you look on the right side there, you can see these are the blood values that have been used for this particular analysis. And this is the kind of thing that is coming to us, and you'll start to see those to be more available. There are other kinds of tests that have come out recently that are combination markers that are being used primarily in research, but they will find their way into the market. There's one recently done by Siemens. It's called the ELF test, which I like a part of it really well because it uses what's called the ProC3, which is a blood marker that measures the amount of collagen that's being active. And that's really important to how the progression of scarring is going on in your liver. So it's a good thing that all of this is happening. So next slide. Other tools that we have available today that you don't get to see usually what the results look like. But there's liver multiscan, which is an MRI tool, which gives measurements of liver fat and iron and stiffness. And similar to that is magnetic resonance imaging. And I've done the MRI, which is pretty interesting because they put a big paddle on your side and it whacks at you and they measure it. And that picture in the bottom center there is actually a picture of the waveforms as it goes through your liver, and that measure your stiffness with that kind of thing. So these are tools that we have today that are non-invasive, but just not everywhere available. So next slide. Another one, which is a similar MRI test, which is measuring. You'll hear it frequently. It's more common than the other two. Is PDFF, which is an MRI measure of fat content, but it gives you similar kinds of looks, which the docs will see, but they probably won't show you. So next slide. So the future is really bright in terms of non-invasive tests that are going to be available to us. It's just that I'm impatient to have them come our way, but I hope this has been a helpful glimpse of some of the things that are available. So next slide.